We're going to move now to Wisconsin, where Christian Schneider is going to talk with us about the Wisconsin Health Policy Initiative. He is a senior fellow at the Wisconsin Policy Research Institute after spending 8 years working in the Wisconsin legislature, so he really knows how the wheels of government work in the state. He has degrees in political science, both from Marquette University and from the University of Utah. So I think that's important because so much of the health policy that we debate these days is based upon political forces. So that gives him, I think, a pretty unique advantage. He's also clearly quite an accomplished communicator. He was named the recipient of the Wiscopinion, which I guess is WisconsinOpinion.com Blog of the Year Award, and contributes commentary to Here and Now on Wisconsin Public Television. So he's a noted blogger, political scientist, and expert in health policy in Wisconsin. Welcome, Christian.
That was quite the setup. I have to warn you, our group, WPRI, is actually a pretty small operation, so my knowledge of healthcare is nowhere near any of the other panelists, or probably anybody here in the audience. So I would ask all the panelists to please speak slowly for my benefit, and perhaps use hand puppets to make their points possible. Wisconsin is kind of in a weird place right now. As mentioned in the past speech from Mr. Hill, other people seem to be kind of moving away towards the traditional single-payer government takeover of healthcare type of deal. With Clinton and Obama both don't move more towards the mandate side of things rather than just the government takeover. But we're talking Madison, Wisconsin here. And for those of you who know Madison, it's kind of like Jurassic Park. I mean, it's where single-payer advocates still roam the earth. The problem is...
It's more terrifying than dinosaurs, right?
Easier to clean up. The problem with the Wisconsin plan is essentially trying to fix a system that isn't necessarily broken. In 2006, only 5% of Wisconsin residents were without health care for the entire year. So we seem to be doing pretty well. As Dave Barry once said, it seems the biggest problem in healthcare in Wisconsin right now is figuring a better way to get to the prostate. And of course, in pushing for their program, they use the same talking point that you've heard, from Senator Obama and et cetera, is that you deserve health care as good as your legislator. I mean, I think we've all heard that, and that's, we all need to have that kind of health care. I think the answer to that is simple: just make our legislators pay for their own health care like everybody else, and then we can. Then we'll all be equal without having to bankrupt the state budget. Okay, a little bit about the Wisconsin plan. It's called Healthy Wisconsin. It was introduced as part of the 2007 through 2009 state budget. There was a public, it was introduced on a Friday afternoon at about 3 o'clock in the afternoon. There was a public hearing on it that Monday, the following Monday, and it was placed in the budget Tuesday. So, yeah, so it had about 16 hours total of debate in the state legislature. I've actually been to Chinese buffets that have lasted longer. It's essentially a single-payer plan. You gotta love the health care. It's essentially a single-payer plan. It's a 10.5% tax on employers with a 4% tax on employees. The board that's set up to run the program can increase the tax from 10.5% to 12%. So the tax is going to be 12%. Initial drafts of the plan had health savings accounts and things like that in there to try to get some votes, but at some point they just said we don't need the crazy right-wingers, we're just going to do what we want. The plan would cover everyone in the state not already on Medicare or Medicaid, and it amounted to, according to estimates, about a $15.2 billion tax increase. Now, by comparison, Wisconsin is expected to bring in $13.1 billion in all of its sales, income, and corporate taxes. So you're doubling the state budget essentially. You know, the historians have looked at this and they've seen that no other state in the history of the United States has willingly doubled their state budget. You know, a tax increase that large. It also sets up an independent board to run the program, with some members appointed by the governor. The board sets up the fee schedule, takes bids from the health providers to take part in it. The board is made up strictly of labor, farm, with some business representation. There are no doctors on the board, no insurance companies. It's like having an auto mechanic teach a cooking class. I mean, you want the people there that know what they're doing. One of the other things the board, this independent board, has the ability to do is to institute cost containment strategies. So you're all healthcare people, you know what that means. You might want to get that knee replaced, and it'll take a while. They actually, believe it or not, do make arguments for this program. They say it's not government health care. It's run by an independent board. The government never touches the money. It just runs by itself. They say the funds that are brought in replace the costs businesses already have in health care. They say businesses already pay more than 10.5% of their payroll in health care, so we'll all be saving money. Get everybody in that pool. They also say that it will reduce the total cost of what we spend on health care in the state. Healthy Wisconsin sets up competition within health plans to try to get state business, and that they'll save billions through people getting preventative care, mandating more efficiencies in the insurance market. You'd think that this is something that Milton Friedman put together by the way they pitch it. One of the authors of the bill actually has a quote where he says, "When we put the package together, we did not want to reinvent things. We didn't want it where it was a government-run type of system. We wanted to keep it in the private sector." Now, there are also arguments against, as you might suspect. And considering the fact that, as they mentioned, Washington might be thinking of something like this, and I think these are worthwhile. Everybody in the room knows the arguments about rationing, waiting lists, cost overruns, and things like that. Michael Tanner of Cato ran the numbers and said there would probably be a $10 billion deficit in the program by the year 2017 if costs keep going the way they are, and if you had to cap it at that payroll tax. The Lewin Group actually did an actuarial study of the program and showed that amongst the $15.2 billion cost, that it could actually cost the state 8,100 minimum wage jobs, because there would be some businesses that would be paying less in health care, although they wouldn't have the flexibility to be able to choose what kind of health care their employees got. But there would be some that don't offer health care that would then be slapped with a 10.5% to 12% tax, which would then would mean laying off employees for lowering wages. But there are two specific criticisms of the program that I wanted to focus in on. The first is the idea that there will be all these savings in healthcare because of this new program. According to the Lewin report, Wisconsin spends $18.5 billion in healthcare every year. The plan supposedly is going to shrink that to $15.2 billion. And how are they going to do that? Competitive bidding of services from healthcare networks, 8% cap on administrative and overhead costs paid to healthcare networks, centralized purchasing of pharmaceuticals, prevention will avoid larger future healthcare expenditures. So all those things are going to save us $3.3 billion in healthcare. So what they're saying is there's going to be less cost through efficiency that state government, now get this, state government is going to come in and tell insurance companies and doctors how to be more efficient. I mean, that's like baseball putting Roger Clemens in charge of its steroid policy. What you're doing with the program here is, you're taking a program, you're increasing the number of people eligible for the program, you're increasing the services offered, you're decreasing the amount of incentive people have to really take care of themselves, and yet claiming and pulling $3.3 billion out of the system and then saying, oh, by the way, there's going to be no change in the quality of health care. The University of Wisconsin system is, the crown jewel of the state. These same legislators that are proposing something like this, you can only imagine if we said to the University of Wisconsin system, okay, you guys have to accept 30% more students, and we're cutting you $3 billion. I mean, they would set the Capitol on fire, saying, oh, you're ruining the quality of education in our state, asking people to do more with less. Well, that's essentially what they're saying that Healthy Wisconsin is going to do. So the bottom line is, while a lot can be done to increase efficiency, I think we all know that, and that's the real benefit in having think tanks look at healthcare. Government regulation really isn't going to do the trick. The next thing that we've been working a lot on deals with the difficulty in instituting a kind of a single-payer system in a single state. I guess we kind of call it the migration theory. Wisconsin has a long history of people moving to our state to get benefits. Some of you may remember the early 90s, where Milwaukee's Milwaukee's welfare benefits were so rich. Buses from Chicago were just coming up, by the hundreds to try to get Milwaukee's welfare benefits. And that's in part why Tommy Thompson instituted the welfare reform that he did, and was kind of a leader in the U.S. I don't see any difference in what's going to happen here with this type of situation. When we have health care benefits that are so rich, richer than the states surrounding us. Here's essentially how the program works. It says you have to be in our state for 12 months before you can get benefits, unless you are gainfully employed. So now this independent board is going to decide what gainfully employed means. I don't know if it means working in an apple cart, working at Arby's, or what exactly that means. But once you move to the state and get a job, you are immediately eligible for the whole enchilada, all the health benefits. But it gets even better than that. Once a single person is eligible, everyone in their immediate family is then eligible. So you can bring your whole family, set up shop, get a job, and then your whole family is covered by the taxpayers of Wisconsin. And it gets better than that. Your entire family, once you're eligible, there's no requirement that your family even live in the state. So, yeah, head on over to CTAC. So you can conceivably have a father from Georgia with 10 kids move to Wisconsin, be gainfully employed, and all of his kids, while back in Georgia, are covered by the Wisconsin plan. I mean, it's absolutely amazing. Now, the proponents of the plan say, wow, that's not going to happen. Every state has their own Medicaid program. Everything's not, the Medicaid programs are working in the other states. Which means, essentially, their argument is, there is a healthcare crisis in Wisconsin to the extent that we need a full government takeover of healthcare in the state. Yet apparently there's a healthcare crisis nowhere else in America that would lead people to leave their states, if they have a pre-existing condition or they can't afford healthcare, and come to Wisconsin and take advantage of the benefits. So that's something that we've written about quite a bit. And they recently just took a poll, and that was the #1 talking point against the plan that people said that would cause them to oppose the plan. And so if something like that happens here in Washington, you can go ahead and crib that for me. So the bottom line is, think tanks do a great job in coming up with proactive solutions for healthcare. HSAs, free market solutions, all that great stuff. But what we really need to do, and is of most value sometimes, is stopping the things that actually are proposed. And I think that's the benefit of what we've been able to do in Wisconsin. So thanks.